Here's how we're going to camouflage your jowls. I'm Janelle, a cosmetic nurse practitioner since 2013. I went to Stanford, I went to Duke. I'm here to help you out. So first of all, what are jowls? Jowls are this little fat pad of skin that hang down beyond the jawline. So people feel like they notice their jawline doesn't look straight. They see this little jowl area showing. Here's how we can approach treating those. Now, only way to get rid of them is surgery, to nip and tuck, get rid of them like that. However, non-surgically, we can camouflage the jowls by doing some filler and or natural filler. We can talk through those differences shortly. Into the marionette line, so like right in front of the jowl, kind of camouflage that area. And then filler along the jawline, in front of and possibly behind that jowl fat pad. That is going to help camouflage them. Sometimes when we do this, we'll also put some filler into the chin. We don't want to just make this wide and you have a short chin, so then your face would look boxy. Another consideration we can do is do Botox into this platysmal muscle. So we have a muscle in our neck. You can see me flexing that muscle here. When we Botox here, this pretty much aligns with where those jowls fall. Botox there, it's going to help tighten along the jawline so things look more defined and the jowls are camouflaged. When the jowls are camouflaged, the jawline looks straighter. A strong jawline, people just feel like it looks so good. It helps to show youthfulness and everybody loves that. Okay, let me know questions you have. I am here and I'm so happy to be back. I feel like I haven't been on here in like a week. I'm so sorry, but I'm here today. I was doing virtual consults. I do virtual consults for patients before they come in. We also have Samantha. We have our other nurses that do virtual consults as well. We like to go through your questions, your goals, tips on what to expect, how to prep for treatments before you come in for your treatments. We start building out your treatment plan with you during that call. We send you notes after the call. You can review everything we discussed. You can further watch videos on it, read written, we have written instructions about the different treatments, and then we send you pricing, financing if you're interested in doing that, so you can do those as well. Okay, let me see some questions here. I have droopy eyebrows, how to fix it quickly. Rose, let me know if you naturally just have droopy brows and we can do Botox to help lift. When we do Botox around the eyes, we can do it right here into this muscle. It's called orbicularis oculi. It is a circle muscle, closes in. We can also do Botox onto the eyelid to help lift those areas. If you got droopy brows after Botox, give me a little bit more info there. They can do Botox to lift in the same areas, your lids and or your brows. We can also use prescription Upneek eye drops that will help lift a couple millimeters on your eyelids. I did Botox on my forehead. I hope you didn't do it yourself. I don't know. Please don't be doing this at home yourself, you guys. Be careful, especially if you don't know what you're doing and how to fix it, if there is one of these, complications. But if you saw it, if you did that, go see your provider. They can help you take care of it. She said, I did not. Okay, good. Go talk to them. They can do Botox around your brows and or lids. It is not permanent, so that's a good thing. But see them. They can also give you prescription eye drops to help lift that. It's not a permanent thing, so that will be good. But yeah, hi Shelly, I hope you're doing so good. Can't wait to see you soon. Okay, if you have questions, we can go through them. I will talk. I saw somebody I'm going to be seeing in here shortly. She heard that sweating, etc. helps. Sweating, it can help metabolize your Botox faster. Typically, when you're still talking about the droopy eyelids, typically it's not a huge dose that's going to be there, so I doubt this is going to last for 3 months or so. But have them go try to lift it. That'll help and get you the drops. Okay. Your take on Clear and Brilliant. I like Clear and Brilliant. I used to do it. I don't have it in my office, but that one is a good one. I love Aerolase laser. With that, we're able to treat acne, dark spots, hair removal, redness, fine lines. So I really love the Aerolase, and there's no downtime with it. You can stack it the same day with your skin pin microneedling if you want to work more on texture, and or your bio repill chemical peel to help with brightening. Sorry. Okay. Let's go through PRF EZ Gel. I have a patient. I saw somebody jump in here, so I'm going to give some tips before they come in for their appointment. So PRF EZ Gel is the natural filler. Oh, and I'll answer some of these questions too. So natural filler, what we do is draw blood from your arm. Then we spin it in the centrifuge. That's the spinner here. After we spin it, it's going to separate out your platelet-rich plasma, your platelet-rich fibrin. That is your body's growth factors, stem cells. We take that, we place it in here. This is a heater. It's going to heat it, and then we also have a cooler that will cool it. So it thickens into a gel. We're going to take that gel. We can inject that anywhere in the face. Very commonly, people like to do it underneath their eyes, into the smile lines, the corners of the mouth. Well, you can do it anywhere. Temples, cheeks, chin, jawline. You can put it anywhere in your face. Your body will make new collagen over time. This is not a quick fix. If you want a quick fix, we're going to go in those areas with filler, as long as you're a candidate for filler. But this natural filler, people love for collagen stimulation, and they love having a natural option where their body will make new collagen over time without any additives, without any filler. So that is a great option. You can do that the same day as your skin treatments. So we were talking about the laser, the microneedling, the chemical peel, and the EZ Gel, the natural filler. You can do all of those on the same day if you want, and even your Botox. So we see a lot of patients that come in every time I'm in clinic. I see somebody from out of town that come in from out of town. And so a lot of these people are stacking their treatments on the same day. But this is also why we do our consult, so we can go through all your questions and goals and build out that treatment plan so you know what to expect when you come in for your appointment on that day. I know I saw somebody in here I'll be seeing soon that is going to be doing microneedling, the natural filler, and Botox on the same day. So this is very common when you come in. I'm taking 2 days off of work for this. For PRF EZ Gel, for doing underneath the eyes, you're going to swell. You might bruise. Swelling with the natural filler looks a little exaggerated for about 3 to 5 days. If you prep before your appointments, so avoid blood thinners, avoid alcohol, take arnica, eat pineapple, do that leading up to your appointment 1 to 2 weeks before, it will help minimize your bruising and swelling. It's going to help you so you're not all beat up. You're going to swell. It's going to look a little extra the first, like I said, 3 to 5 days. After that, it settles down. You're going to be fine. I've not had anybody with any long-term issues with a natural filler. Now, a regular filler, a little bit more temperamental. We have to be more mindful when it comes to regular filler, making sure you're the right candidate. We put the right amount, the right product in the right area. But the natural one, you're going to be fine. You're not going to have any allergic reactions to it. You're going to be very great with that. I've done the natural one, my whole face. I love it. I've not had regular filler for over 3 years. I like filler. I'm still breastfeeding this baby, guys. He's getting weaned. But I really have liked this this natural one. It gets progressively better. It never looks overdone. So that is, I think you're going to be totally fine. Okay, let's see. Let me see these questions. Why do people put it in their chin? What does that help with? I have dents in my chin, was debating Botox for chin. Okay, so Shelly, and we will talk through this too when I see you, but this is, we can do filler or the natural filler into the chin to help elongate the jawline. When we do filler or the natural filler here and we're elongating jawline, it can help balance some of the features. So naturally, if you have full cheeks, full nose, full lips, all your focus is here and your chin is set back. We don't want the lips to dominate and like project beyond the chin. If we do that, it can look a little off, or people consider it, oh, that looks like duck lips. So we want to be mindful when we're doing any of these treatments that the entire face looks balanced and nothing is like overdone. That's a big thing. If you have dents in your chin, usually that means like the muscle is kind of contracted up. So putting some filler or the natural filler in there can help give some support under the chin. And so then it'll help those dents not show up as much. You can also do Botox, but Botox is not going to give you much forward projection. Let me show you some pictures of what chin filler can look like so you guys can understand what we're doing here. And like most of these people here have chin filler. So this patient came in, she wanted to do lips. I was like, if we only do your lips are going to jut past your chin. That is going to look a little off. We did some filler into her chin, brought forward her jawline, was able to add some more into her lips and help things look a little bit more balanced. Here's another person that has filler into her chin. I hope you guys can see. I cannot see here. Again, elongating jawline, helping balance the upper to lower face ratios. She has filler into her chin as well. Gives a teeny bit of length. Also, if you look at her, can you see, guys? I hope you can. If you look at her before, more highlight in the mid face, and then it looks more shadowed in the lower face. So we softened some of these shadows around the mouth, and then we gave the smallest bit of length to her chin. So it's not just the highlight in her mid face anymore. She has a little bit more balance there. She's done lip filler and she also did chin filler. Again, elongating jawline. We can shape the chin if you want. I think I have some guys over there, some photos. If they want to make their chin like more square, we can do there. We did filler into her chin. She came in first. She only wanted to do lip filler. I was like, look, look, look. Can't just have big lips and then saggy little lines right here at the corners of the mouth and your chin is set back. We also have that little sign of jowling, early signs of jowling. So we did filler into the lower face, into this pre-jowl area, marionette lines into her chin to elongate. Here's another one with the chin. Same sort of thing. You can see it really from the side profile. People will feel more confident is what they tell me, taking pictures from the side, but brought forward her chin so her lips are not projecting beyond the chin. She also did filler into her chin, into the marionette lines as well to bring a little highlight. So you guys probably have a lot of questions. I was just going through those. There's a bunch more chin photos over here I can show you. Most of the patients are doing some filler into their upper and lower face, or the natural filler. When we are doing these treatments, I'm thinking about your full face from all the angles. We don't want just one spot looking hot and fresh and the other spots looking not. We need everything to like be all aligned. So that's how we're considering the full face. Okay, so she's taking 2 days off work. Do you do EZ Gel? And if so, what is the cost? Yes, pink lip gloss. We do EZ Gel. I was showing that earlier. The device over there, our centrifuge, the spinner, the heater, the cooler. That's the natural filler. I was saying I have been doing that the last couple of years. I have not had filler in over 3 years, even though I like filler. I've just been breastfeeding. We do PRF EZ Gel, minimum of 2 sessions. Do some, let it chill, come back a month later. We retreat those same areas. We're trying to stack those growth factors and stem cells into the same area. This cost is $25.50 for the 2 sessions. In our membership, the EZ Gel is discounted to $9.50 a session. So we have a membership. You come in on a monthly basis, our skin membership. You can get one of our skin treatments. So you have Aerolase laser, skin pin microneedling, bio-repill chemical peel, or our hydrofacial. We can help you choose which treatment is going to best serve you in that moment, in that month, depending on your skin concerns. You can stack those treatments. Most of our patients are stacking 2 to 3 treatments in the same day. So they're laser, the pill, the hydrofacial, all together. Or they're doing the laser, the pill, the skin pin, all together. And then they're throwing in their natural filler on top and their Botox on the same day. So when we're stacking those treatments, you're able to work at different depths, different layers in the skin. And so you're able to target multiple things all in one session. There's a little bit of downtime if we start doing it with skin pin microneedling, but otherwise the other treatments have no downtime. They're safe for all skin types, all skin tones. I say that all the time because not every treatment is safe for black and brown skin. So I do mention that. Okay, does microneedling get rid of minimal, dark, or deep dark acne spots? Microneedling can help with acne scars, texture, dark spots. Yes. With microneedling, the pin is over there, the device is over there. What we're doing is creating controlled wounds in the skin. When your skin notices that there is a wound, it's going to come back and repair itself. So really, I think microneedling stands out for fine lines, pores, texture, acne scars. Those are standouts, in collagen stimulation. Again, safe for all skin types and tones. You got to stay out of the sun before and after. You don't want to be getting sun on this open wounded skin, or you can make dark spots get darker. I do give a heads up to black and brown skin, anybody, but like black and brown skin, the skin can look darker during the healing phase because it's these little micro injuries, like micro scabs. So that's normal. You don't want to try to peel them off. Don't try to expedite it. You're going to mess your skin up. Just let it settle. You will notice over the week or 2 that they shed off. So yeah. Does the blood have to be chilled for a month in order to come back to get injected? No, Shelly. So when we do your 2 sessions of your PRF EZ Gel, we're going to draw your blood that day. We spin it, we heat it, we cool it, we inject it that day. When you come back again, we'll do your in a month later, we do another blood draw and we do it again. So most of the time we're doing the blood draw, we do 2 tubes. And with that, we're able to get about 5 syringes worth of your natural filler, the PRF EZ Gel. And then we can inject that in different spots of the face. Most commonly, people like under eyes, smile lines. If you have a lot of hollowness, a lot of sunkenness, or if you want to treat your full face, when people are like, I want to do my eyes, my smile lines, my temples, my cheeks, my corners of my mouth, my chin, when we're going over multiple areas, instead of drawing 2 tubes, we're going to draw 4 tubes. When we do that, we get double the amount of product and we have more that we can go into different areas of the face. If I just take 5 syringes and I try to put one here and one here and one here and one here, I'm like, you're going to spread it too thin. You're not going to see a difference. We really want to stack those growth factors. Okay. Let's see. Let's see. I heard you're going to court because your face card is legal, period. You're so sweet. Thank you so much. I want skin like yours. I have light pigmentation. Betty, thank you. So the skin treatments, guys, what I have in the office is what I do and like what I stand behind and what I believe in. So I'm Janelle, a cosmetic nurse practitioner since 2013. I say I went to Stanford. I went to Duke. I'm telling you guys these things because I don't play around when it comes to your face. I don't play around when it comes to any of this. Like I take this so serious. This is not a game to me. Your face is not a game. Like this is serious. I say that because I want you guys to be mindful about who you're picking and choosing to do your face. I know people are like, I just went to this place. I saw this Groupon deal. I saw this cheap. I'm like, don't do it. I tried to do this at home. I'm like, don't do it, guys. I had one of my consults today. She's like, I just went somewhere in Arizona. I'm like, Arizona, they have random, any random person can inject in Arizona. Like you want to go to somebody who studies this. Like I studied the face. I have studied anatomy. My team, it's not just me, I have a whole team, but like, this is so serious. And these things can have complications. So like you need somebody that is going to do all the right things to minimize the risk for complications. And then if there is a complication, they know how to intervene and they're going to take care of you. Sorry, I'm not yelling at y'all. You guys just know this means a lot to me and I want you guys to be safe when it comes to your face. But I don't even know what the thing was. So the treatments that I have, I stand behind and we see results. We use them. We get results. The patients love them. Read the reviews. You can look up Jossie Skin and Wellness or Janelle Beauty Aesthetics. It used to be Janelle Beauty Aesthetics. We switched the name the end of last year. So under Jossie Skin and Wellness, but read the reviews, look at the patient before and afters. Like we do this stuff, we build out a treatment plan. We're not rushing it. When people try to rush, I'm like, you don't mess up your skin. No, we know how these treatments perform together, how they perform in different skin types and tones. We have the palest of pale to the darkest of dark. I treat all the ages. I treat boys, girls. I treat everybody. I'm transitioning. We treat all the people. And we get beautiful results. And the people, they are happy. They are like, I look like myself. I look fresh. Nobody knew I did something. They can't tell what I did. They can just tell like, why are you glowing? What is going on? Like, oh, like, it's subtle comments they hear. I got carded, little things. Did you change your hair? Did you change your makeup? People can't pinpoint it. Gosh dang, I will tell you, I was telling somebody today on my calls, I was like, sometimes I see my patients back and I can't even remember what I did. They look so good. That's the freaking point. Like, we don't need to be able to clock what went down. I don't want to be able to be like, I did this and this on that person. No, when I'm looking at someone's face, I'm looking at how light hits off their face, where we can minimize shadows, how we can make things look lifted. Think about like a makeup artist, photographers, any sort of art person, digital art, architects, they all understand what I do very well because it's about lights and shadows. I'm trying to make the face look useful, not puffy. I don't want it to look just big puffy here, big lips and short chin. I don't want big cheeks and sunken temples. Like, I'm looking at you from every angle. I ask a bajillion questions about you and your lifestyle so we can make sure whatever we're doing is going to play into you and your lifestyle and what you want and your goals. So what we do is not random and it's not the same. It can be twin sisters and they can have completely different things. One could be a sex worker and one could be a church choir deacon. I don't know. Like, I need to hear from that person. We need to talk through their questions, their concerns, their goals. Then we build out that treatment plan. So every face is going to be different. It's going to look like you. If you saw those faces when I was showing earlier, I'm like, they all look like themselves. If I just showed you the afters, you wouldn't know they've done Botox and filler and skin and all their things. Like, they just look fresh. That's the whole point. Like, if you just look at their afters, but when you see the before, you're like, oh, dang, I can see the difference. But like, you can see the after. They just look beautiful and they look like a normal person. Like, that's the goal, not like screaming and blaring that they've done a bunch of stuff. Okay, sorry guys, you know I'll be starting to scream. Okay. I'm trying to see if I have no definite, I'm going back to see if there's questions I missed, and I know there are. You guys know I started screaming. Okay, I have no definite jawline because genetics. I've been reading filler is what's gonna help. Ashley, possibly yes, filler can help with defining the jawline. When we do filler along the jawline, things that we want to consider. We don't want to do too much to just make it look so cool from the side. I got to make sure from the front it doesn't look too boxy and too wide. That would look bad. That's going to look like you did a bunch of filler in your face. It's going to look weird. So we got to do some here. If there's like no separation from here to here, it's nothing. It gets a little hard to build out a jawline. I'm trying to look for the pictures around here because I have like different photos. I'll try to grab. For guys, I can do it a little bit easier because they're okay if they look a little bit more wide and square. They like, it looks a little more masculine. For women, I'm like, I got to tread lightly there. If you have a lot of fullness underneath, the biggest thing I'm like, hey, if you can get rid of some of that fullness, whether people say weight loss or you can do, a surgery, liposuction, you can do that. Non-surgically, you can do Kybella. It's a permanent fat dissolver. It works. It just takes a long time. I tell people, I'm like, if you're open to surgery, do the surgery because this Kybella is going to take us forever to get to the point. Reducing some of I'm looking at all these photos around my office and they're like popping up. So I'm like, oh, that's a good one. Reducing some of the fullness will help show the jawline naturally. Then we can go in there with filler and or Botox into the neck bands. These here, Botox in the neck bands is going to help give a little tightening along the jawline. So possibly filler, but I got to look at your face first. Okay. Is this 30 messages? I'm trying, guys. Okay, what trying to treatments can be done during pregnancy? See, nothing. Like you can do maybe like a facial. Like don't do too much of these things. It's I don't want to say it sucks, but you're going to be glowing naturally because you're pregnant. I've been breastfeeding for the past 2.5 years. And so I'm not doing Botox and filler. I've been doing the natural filler. Okay. Where do you inject for a turkey neck after weight loss? If you're open to surgery is going to be the way to nip and tuck it. We do non-surgical things in this office. Botox into the platysmal bands, into the neck muscles is going to help with the turkey neck. If it's just excess skin, surgery is going to be the only thing. If it is the muscle kind of flexing, Botox will help give some tightening along there. Okay. How do I feel about PDO threading? Meh. No. If I feel like it's great, I will offer it in our office. PDO threads, I've heard from too many patients, they didn't see any results from it. They went and they did it somewhere, they didn't see results, or it was, I think I saw a result, but I'm not really sure, or they had complications from it. And even amongst the community of like aesthetic providers, I've been in this a long time, for the last 13 years, it's super mixed on if people think it works or not. And I'm like, I don't need mixed results. I need like, this is going to work, period. So when I've seen thread results that I liked, the ones that I've liked, they were combined with like filler and Botox and all the other things. And I'm like, I think I can get that result with just the Botox and filler without doing the threads. So do y'all do PRP? Is it good for black skin? Is it good, period? Yes. So we do PRF EZ Gel. So in that process, we do the blood draw, same sort of thing. We extract the PRP and the PRF, platelet-rich fibrin. Those are the growth factors and stem cells in the skin. We don't just do regular, like injected in the face. We take it a step further. We heat it and cool it. There's a lot of good science and research behind this showing that when you heat and cool it, those growth factors stay in the skin longer than if we just inject it. If you just inject regular PRP, the growth factor, you get it for like 3 days. You get to see in the skin for 3 days. PRF, you get it for like 3 weeks. When you heat and cool it, you get it for up to 3 months. When those growth factors are in the skin longer, your body has more chance to make new collagen. So that's why we do that extra step. It works very well. It is not a quick result. If you want a quick result, go with filler. It can take up to 6 months to see the full effect from your EZ Gel. So that is something to keep in mind. With EZ Gel, I have two beautiful plump cheeks like yours. I've lost 150 pounds and my face is sagging. Would EZ Gel be a good place to start? Yes, it is a good place to start. If you want instant result, then we can go in with filler. You can also consider dilute radiesse. That is a filler that mimics bone, but we can thin it out a little bit with saline, and it has collagen stimulating properties. So if you want like more fast results, we can go in with the radiesse or dilute radiesse. The natural filler, it's going to take a little bit longer, especially when people have lost 150 pounds. Sometimes they tell me like they want to see it a little faster because they're like, my face is sagging. I'm not used to seeing this. I don't want to wait 6 months for this. Like it just took me 1.5 years to lose the weight. I don't want to wait another 6 months to get to the point of that. So you can totally do it. If you want to see a faster result, that's when we go in with regular filler or collagen stimulator. Claudia, I go to her office once a month. She's passionate and makes you look like you, but better. Thank you so much. She said I'm passionate. I know. I just love it. I love it though, guys. Like, I wish I didn't like it so much, but I cannot turn off my brain. I love this stuff. I freaking love my patients. Like, we want the patients to look and feel great. We know about all the people, like I know who you are, Claudia, right now. Like, we know about what's going on in the life, and that is the point. Like, we want to make sure this fits for you and your life and what's going on. And we know it's not just like you're here and getting Botox shots and you're out. Like, we got to know about you and what's going on and how you're feeling, all those things. So it's a conversation. And I like it. I learn so much from my patients all the time. Hazy, I hope you're doing so great. In terms of an injector or medical center, if my question makes sense. Okay, V, let me see. Is there any specifics I should look for or things to avoid if looking for under eye filler or PRP? If you're going to do filler underneath your eyes, you better find somebody that does it a lot and that can show you really good results. Don't just go to anybody for under eye filler. PRP, you're not going to mess that up so bad unless they're injecting too superficial, but regular filler, they better do it. They better show you. I can show you all these people. I will show you a face that looks like yours and eyes that look like yours, because thank you, Jesus, but thank you to our patients who have allowed us to share their photos. A lot of patients have consented for us to use these photos to help educate and show, like, hey, here's what natural results look like. We got all the different faces, all skin types, all skin tones. We want you to be able to see somebody that looks like you, so you can understand, like, hey, this is what it can look like on you. But under eyes are an area that take like precision, and they, like, if they're not doing this all the time, don't do it. They need to show you lots of before and afters. They need to make sure you're the right candidate to do under eye filler. You have to make sure you don't get puffy underneath your eyes. You don't cry a lot. You don't have bad allergies. Anybody that retains a lot of water around their eyes, they're not candidates for filler, because filler binds water. So then they're going to puff up. You don't want that. It's going to look bad. So you got to make sure you're a candidate. I do under eyes in 2 sessions. I do some, let it chill, reassess, come back later, 6 to 8 weeks later. We can always add more if we want. We just don't want to overfill. Overfill under eyes looks so bad, guys. It looks so bad. And it lasts a long time underneath the eyes. So do it right the first time, every time, period. That is that is important. The PRP, do the EZ Gel. That you're going to get a better result with it. So just make sure you're finding somebody, first of all, licensed, period. I don't even understand, but people will go to unlicensed people, and I get it. They're like, this was $200. I'm like, dude, nothing I purchase, my cost is not even $200. Like, they're, I don't know what they're getting off this black market. Don't do that. So find somebody that's licensed, that can show you pictures, read their reviews, ask them a bunch of questions. Like, ask all the questions. I tell the people in the chair, I'm like, ask me every question. We can go all day. I want to hear everything on your mind. There is a specific reason on why we are choosing X, Y, and Z for you in this moment. And I'm like, try to trip me up. I'm not trying to be like mean. I'm like, I want you to have the questions. I want you to have an active voice. I want you to make informed decisions, not rush decisions. This is not willy-nilly. And if you ask me, well, why did you do that much? Or why did you use this? And well, I'll tell you exactly why. Like, there's a lot of thought. As you're talking, I'm like, thinking in my head. When you walk in, I'm already I'm thinking all the things. And I'm praying first and foremost. I'm like, God, show me what to do and how to serve. Okay. Where are you located? We're in Los Angeles and we're in Las Vegas. In Los Angeles, we've got Mar Vista. So this is like outside of Culver City. We've got Torrance, that's in the South Bay. In Las Vegas, we're on the Summerlin side. Sinclair, you look amazing. Thank you. Hi, Claudia. She says she's done this with Janelle. She loved the results. I've kept up with the hydrofacials. We love seeing you. Thank you, girl. Okay, I think that I got, okay, now I think I went back and I got them all. I'm going to go back down and see. Your skin is popping. Thank you so much. I've been alternating between the laser and the chemical peel. The last 2 months I did the laser. Prior to that, for like 4 or 5 months, I had done the chemical peel, bio repeal chemical peel. I like those because there's no downtime with them. I can do them fast. I'm not shedding and peeling. I get a pretty glow with it. I can visibly see a change with those treatments. And microneedling, I love too. I just probably do it the least amount. Mostly, like, you got to keep your skin clean. No hands on your face, no hair on your face. I have kids that are like slobbering on me and putting their toes on me and stuff. And so my face gets my kids on it. So Microneedling, you have to be more careful with for the first 48 hours, infection control wise. But the other two, no downtime. I can get back to life quick. I'm not peeling. It's easy. I love those two. I'm probably going to do a bio repeal very soon. Maybe I'll have one of my team do it and we can show you guys. When you do the peel, it's like no drama. You want to make sure you stop any active ingredients like tretinoin, your exfoliants, a week before. And then we put the peel on. You might feel a little slight tingling, anywhere from a 0 to a 3 out of 10 on the pain scale. We have it sit for 7 minutes and then it self-neutralizes. So after 7 minutes, the active ingredient stops penetrating, but we will clean that off. People are like, my skin is glowing right after. I'm like, I know. I'm like, I did not want to get caught up. I don't get super hyped about treatments and aesthetics because I have been around so much and I've seen so many things and I've seen a lot of things flop. But this peel, I'm very slow to bring anything on in the office, guys. I got to like stand behind it. I'm not going to be on here telling you about something and you come in and it's trash. Like, no, I'm standing behind it. But that peel, I'm like, dang, like I just feel like so glowy after. Our patients love that one. And the laser, I feel like I noticed probably a week later, my skin looks a little bit just like filtered with the laser. So those are both great. My favorites. Capri said, I need to come see you this year. I would love to see you. We can do talks. I'm not seeing, what did she say? She said she's not seeing any results. Okay. What could you recommend to use with Sculpture when injecting? I'm not really seeing any results. This would be my 3rd time going. We use Sculpture in our office as a collagen stimulator. I probably use other things more than that for collagen stimulation. EZ Gel is probably our main one for collagen, so that's the one made from your own growth factors and stem cells. Secondary to that, if it's not that one, I'm going to be probably grabbing, I don't really talk brands on here, guys, so only on lives if you're really catching me. Probably use Dilute Radius a little bit more than Sculptra, but both of those are collagen stimulators. Wherever we inject it, your body will make new collagen gradually. I feel like I can see faster results with Dilute Radius relative to Sculptra. However, I use them both in our office. If somebody really wants Sculptra, I'm like, totally. With Sculptra, common areas I will treat are like temples, mid-face. If you're like looking for a lift, if you're like, I need to see a lift, Sculptra is not going to give you a quick lift. That's where you're going to go in with your regular filler. So, and then which filler we use, it's like I got to look at your face. I got to talk through a bunch of questions. I got to feel on your face, how deep your bone is, because we have different fillers available to us that are FDA approved, and they have different properties. You can't just be like, my best friend got that one, or my mom got that one, so I want that one. Like, the face is different. It depends on what part of the face we're treating. It depends on how much volume loss there is. It depends on the goals, what we're trying to do. That will determine which one we use in what part of the face. And I will use different parts of different fillers in different parts of the face on the same day in a person, depending on what we're trying to achieve. So this is what I'm saying. There's a lot of thought that goes into it. I will say, not all injectors are doing that. A lot of injectors are like, oh, this one's cheap, I'll just use this one. I'm going to save, $50 if I just use this all over the face. And I'm like, no, I need to get you the freaking result, period. Like, I'm not going to make any money. It's not even about the money. I'm not even freaking, money will come. It's not even that. It's like, get the dang result, period. And the patients will be happy. Yeah, so that's me. Sorry. I'm screaming all the way. Love your hair. Thank you. My hair, it's windy in LA and my hair was blowing. So this was day 2 hair. This looks like day 4 hair. So I'm going to have to wash it again very soon. Okay. Daisy, I asked, how long does it last? Facial balancing. Not sure if I'm being ignored, respectfully. No, Daisy, you're not being ignored. I'm just trying to get back up to the questions. It takes me like 10 minutes to answer one question. Okay. Facial balancing. When I was showing you guys those pictures on the wall and all the different faces, and we've treated with Botox, with filler, all that. When you're doing your facial balancing, your filler appointment, you're likely going to do this over 2 sessions. Do some, let it chill, come back 6 to 8 weeks later, fine tune if we need, if we want. If you're like, it's perfect, cool. You're going to do your maintenance between 1 to 2 years. I feel like most people come around like a year and a half, and then we will reassess, do their face at that point. Usually when they're coming in for their maintenance, we're not having to do as much as we did the first time. Now, if you're like, hey, I saw you a year ago, but since then I lost a bunch of weight, and your face is going to look different. So this is why we got to assess it. So I might see you sooner than, a year and a half if you go through major changes. But yeah, I'm sorry. I'm not trying to I'm not trying to ignore you guys. I'm just trying to scroll up. Okay, I'm going back up to the last 20 I missed, and it says there's already 20 more new ones. Okay, Sandy. Hi, so good to see you on here. Used to go to you back in Hermosa. I hope you're doing so well. I started in Hermosa Beach, and then I was in Brentwood, and then now, and I was with amazing clinics. I'm so grateful for them. They taught me the things I know. I never planned to go out on my own and have a team and have multiple locations. This is all God's plan. But I went out when I had my second baby. This was in 21, and I was also fostering twins at the time. They were 18 months old, and so I was like, I need to be able to like see my patients, go home, and like be with the kids. And yeah, so, and then I thought, oh, this would be easier to do it on my own. I don't know if it's easier. I just am grateful because I get to do the treatments that I truly believe in. And I get to see the patients that I'm like, I feel like God has brought me to serve these people. Yeah, whereas before in the other offices, I have to do whatever devices they brought because that provider, that owner of the clinic believed in. I'm like, these are things that I believe in, that I see results on. I get to see all skin types and tones, whereas in my other clinics, it wasn't as diverse. So I'm like, I'm doing treatments that I know are going to work for everybody. And for me, being Filipino and Black, it like means a lot to be able to use treatments that work on Black and brown skin. Okay. Felicia, hi, does EZ Gel help with under eye hollowness? Yes, we've been talking a lot about EZ Gel. I love it underneath the eyes, period. Okay, because I'm like, I should probably not talk so long, guys. Okay, Trisha, I will be 50 in April. I look young. People often think mid-20s. Hey, should I start getting Botox? That's if you want. If you are like looking and feeling your best self, I'm like, you don't have to do any of this. I'm never here to like try to tell people, you got to do Botox, you should do Botox. I love Botox, I love filler. I'm like, if you want to do it, let's talk about how we can make it look good for you and your face. Let's make sure it's safe. Now, I think these things, I have seen them time and time again. Over my 13 years I've been doing this. I have seen how these treatments can work and help people look and feel their best self. But I'm like, Trisha, if you're already feeling great and looking and feeling your best self, then girl, you don't need it. I think things to do that you should do are like using sunscreen, all skin types, all skin tones. Reapply your sunscreen. I think a lot of people are like, oh, Black and brown skin doesn't have to do it. I'm like, no, we got to do it. That's going to be protection against skin cancer and then visible signs of aging like fine lines, dark spots. So like do that. That's a baseline thing. Using a retinoid at night helps with skin I should talk to you about my skin products, guys, but okay. Using a retinoid at night helps with skin cell turnover, fine lines, pores, texture, dark spots, acne, collagen stimulation. So mine is up there. We have Jossie Resurface RX. You can also use tretinoin or Retin-A. That's a prescription one if you've been using a retinol. So I'm like, at least do your skincare. Red light therapy is nice if you're consistent with it. But like, I don't be like, yeah, do Botox. I think if you do Botox, you'll like it. But if you're like, people already think you're 20, what are we going to think you're 10? So I'm like, I don't know. It's up to you. Where are we located? We're in Los Angeles, in Las Vegas, in LA. We're in Mar Vista, Torrance, and then in Vegas, we're on the Summerlin side. Okay, I have melasma on my forehead. What do you recommend? Microneedling. So melasma, it's tricky. First and foremost, you're sunscreened up. Tinted sunscreens do well, and stay out of the sun. Try to avoid the triggers. I know it's really hard. Melasma, we can never cure it. We're trying to keep those melanocytes, those pigment making cells, like at bay, trying to temper them down. You can do microneedling and that can help. The Aerolase laser can help. The bio refill chemical peel can help, but we also are going to pair that again. You're upping your sunscreen, increase your sunscreen use. You can use your retinoid. It's going to help with that as well. And hydroquinone is going to be a fading cream that you can use, prescription we can do. So, and then you can only use that short term, use that for about 2 to 3 months, give it a break, and then go back to it again. But melasma you can never cure, which sucks, but we can keep it tempered down pretty well. I really like, for melasma, I like the pills. I think those look really well. Biorefill chemical pill. Okay, Daisy, I see your thing where you said, how long does facial balancing last? We got that. I said 1.5 years, probably going to be where you're going to land. Anywhere from 1 to 2 years. Where do you inject for, we talked, okay, we got these, I got these. Now go back down, 31 messages. Best sunscreen. Oh, I love our Jossie sunscreen. Crystal clear mineral SPF. I made a sunscreen that is not going to leave a white cast on Black and brown skin. That is a zinc-based sunscreen. I fostered twins. You're amazing. I have twins. And to my older boys, it's rough. Yes, we had our babies from like, it was 2019 to 2020. It was like 2.5, almost 3 years. They got adopted by another family. We were going to adopt them. There was just some issues with the court and their mommy and all these things, but they are doing awesome and they're big now and we get to see them and we're very grateful. And that, I feel like a crazy person. It was a lot, but I love it. Okay. Daisy says she said she asked it 4 times. Okay. Sorry. I hope I got your question, Daisy. I'm trying to scroll back up to them. Okay, let me see. Okay. I was not ignoring you. Okay, why laser? Which you said? Oh, what laser? Aerolase laser is what we use in our office. It took me a lot of time to find one that was going to be able to treat black and brown skin safely, and not just black and brown skin, but everybody, but can do multiple things, and then there's no downtime with it, and we can stack it the same day with our other treatments if we want. So, okay, pink gloss. I'm trying to see. It looks like you said is supposed to rebuild fat pads in the face, breasts, etc. Do you think it's possible? What is she saying? Have you heard of supplement by osmosis? I have not heard of that. It's pre and probiotic, omega-3s. It's probably fine. I have not heard of it though. Let's see. Do you prefer Botox or Dysport? I like both, and we use both in our office. Like if it was on my face, I pick Dysport. I feel like for me, Dysport kicks in faster. It's a little bit stronger, lasts a little longer, but they're both great. So they're both great. JV, thank you so much. Okay, I think I got those. Okay, first time. Okay, I'm not sitting. Okay, this is it. First time with Tox 3 weeks ago. Only did my 11s and my DAO. Want platysmal bands done. Is it too late to do? See, honey, no, you can do it. You can do it because it's a whole different area, and it was 3 weeks ago, so you're totally fine to add that on. So you did your frown lines. Ignore mine. I'm breastfeeding. So you did your frown lines. You did your DAOs. These sad lines, like when the corners of the mouth turn down, so they don't turn down. And now you want to do your platysmal bands. Yeah, you can go back in and do it, or you can just wait till you do your next session in 3 months. I think you will really like this. Patients, when I do this, they always ask me, they're like, do that again, but this time add more. They're like, do extra, but it does help. People say like hides the turkey neck, makes their jawline look more defined along the jaw. I really like that one as well. Okay, okay, I think I got him. Hold on. I'm going back down. Okay. For a long time, under eye dark circles and hollowness. I'm 48, never had anything done. What do you recommend? Okay. Dark circles, I'll talk about this real quick. If it is just pigment, even though you said hollow, and I will get to that in a second. If it's just pigment, guys, I don't know anything to change the color of the skin under our eyes. If I put any makeup on, I will put a dab of concealer there because I have where my eyes are darker underneath, like the skin is darker. So I don't know anything to change the color of the skin. Usually on black and brown skin, the skin is darker. On somebody that's more fair, I can see their blood vessels through, so it's like almost purple. I can see it through, so their skin looks darker. I don't know how to change the color, period. You can try the laser, the microneedling, the bleaching cream. I've done it for people. I've done it for myself. I don't see any change in the color. Now, hollowness. If you have hollowness, sunkenness, volume loss underneath the eyes, that can create a shadow, making things look darker. So the hollowness, we can lift with filler or the natural filler. I'm going to show you some pictures here in a second. And when we lift the hollowness, things will look brighter underneath the eyes. Let's show you a picture of a patient that I just have on the wall right here. So for her, she came in feeling hollow and dark. Now, we lifted the hollow by putting some filler underneath her eyes. So it's lifted so she doesn't have these like little fat pads, little eye bags showing anymore. But she still has the pigment. However, people will tell me, they're like, oh, I can cover this with concealer. When I tried to cover this with concealer, it didn't work. So it looks brighter. Light reflects off the face a little bit better because she's not having that little indentation there. Let me show you another one. These are just some photos I have on the wall. Okay, her is another one, and you can see, so I lifted under here. She still has like that purplish tone underneath her eyes, but it doesn't look so bad because it's not sunk in from hollowness or volume loss. Okay, all these people got under eye fillers. I'm like, let's show you all of them. Same sort of thing. Can't take away the fat pad, but we went into the hollow underneath there, lifted the skin, looks brighter underneath. He still has his fat pad. Skin color is the same. It looks brighter. Who else? Same for here. She's still like, I didn't change the color of her skin, but when we softened that sunken and hollowness, it can look brighter. Same for her. This is when she came back for her second session. So this is after her first session, like 6 to 8 weeks later. Still has a pigment, but it looks brighter. It looks smoother. You know, if she wants to try to cover the darkness with concealer, she can. This is immediately after filler, so you can kind of see she's a little poked up, but you can see my poke marks. Poke, 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 poke. So she's red right here. I'm like, see past the redness. What I did is went into that area where it's hollow, that sunkenness. It's gonna look, I mean, it already looks brighter on her face, but I know there's red. I can see through the redness. It's gonna look brighter, and I've seen her afters, and I've shared her like after photos, her hot selfies, because she has sent it to us and shared them with us online. So if it's sunkenness, volume loss, we can do something. If it's like, I'm not sunken at all, I'm only pigment, the color, I don't know how to change. Okay, let me see. If you could, Janelle, if you could only have one skin treatment to keep your skin youthful, what would it be? Gosh, you sound like when I have my girl help me film videos. Skin treatment, I would go with BioRefill. Gosh, dang, that's a hard question. BioRefill chemical peel. I've really been liking that one. And then if it was injectable, it's going to be the natural filler. Those are my favorite two. Dang. But I mean, I love Botox. I love them all. I'm like, that's like seriously saying pick your favorite kids. And I do pick my favorite actually out of them. But if I could only do one, it'd be the BioRefill chemical peel. Mostly because I feel like now I'm not breaking out. If I had acne, like back in the day when I was breaking out, I would go with the laser. Right now I'm not breaking out. I just want like brightness and no drama. I love the peel. And I feel like the texture, the tone, everything looks smoother with the peel. And then the natural filler, I'm like, it just gets better over time with that new collagen. Like, y'all, after 25, we need to be making new collagen because we are losing it. And collagen keeps things looking lifted and useful. When we lose it, things look sunken and saggy and droppy. I'm 38. I have breastfed 3 kids. I'm still breastfeeding the last baby that's getting weaned right now. But like, you know, when we age and with weight losses, changes, fat loss in our face from breastfeeding, we will start to get sunken here, under eyes, cheeks, here, then all the spots. Like you know, we've been looking at these faces here on the thing. It's natural with aging, and it's nothing bad. It's just people are like, hi Trey, thank you so much. It's nothing bad. It's just like they're like, it's like different seeing their face. They're like, I don't feel like this is me. Like I know like what happened, and yeah, I get it. Okay, let's see. I'm trying to see. What is this filler called? Come to Toronto. Somebody else said it to me the other day. Filler, I don't know if you were talking about under eye filler or if we were talking about the PRF EZ Gel natural filler. When it comes to filler, I use different ones. Remember I was saying earlier, it depends on the face, who I'm treating, what part of the face I'm treating. I could be using multiple fillers in a face depending on the area. Like what I do in the lips versus the jawline is going to be different versus the nose versus the eyes, the temples. I'm going to be using different things, and what I use on a 20-year-old black girl is going to be different than what I use on my 65-year-old white girl. So it's gonna be different. Okay. Hi, Milton. He said my under eyes are healing really well. Oh, Milton. He was one of the guys I showed over there. And we did an under eye filler. Oh, so that picture was from like 4 years ago, and then he came for maintenance of his under eyes recently. Like I don't know. I saw him maybe 2 or 3 weeks ago, Milton, and. Yeah, so like that was his before earlier from a while back, and it hung on a long time. But this is why earlier when I was telling somebody, I'm like, if you do under eye filler, see somebody that does it all the time. If they're not doing it right, it's going to look bad, and it's going to be hanging on for several years and look bad. So yeah. Pink lip gloss. So you're amazing. I want to come to your clinic in LA. Would you be the one doing the procedures? Yes, I do. I treat in all the offices. I also have amazing team members, guys, that I train and that I have worked alongside with for several years. They're excellent, but I do see patients. I see patients in LA and in Vegas, and I love it all. Hi, Milton. Hope you're doing so good. Okay, I think I got the questions. Let me see. He says, I can come on and show my results. Hold on. Let me see if I can make this work, Milton. The other day I was trying to do side by side, and Let me see if I can make him bigger. Let me see. Okay, you guys need to follow him too because he teaches you how to speak Spanish. Milton, what do I need? Oh, hi!
I'm
How
here.
are
Hi.
you? You're so cute.
Hi,
Hi.
Janelle.
I've been with Milton a long, long time as my
Like,
patient. Like right when I
four,
very first started on my own.
I want to say like 4 or 5 years now.
Oh yeah, it's
Yeah.
been some time. I'm surprised I caught you. I thought you'd be like in another country right now. He's
No, I got a flight out tonight. I'm going to North Carolina, but
on the flight somewhere.
I know I was scrolling on TikTok and I saw you. But no, I just wanted to show you that everything's healing like super, super good. I got
Was it
my,
like 2 or 3 weeks ago?
no, I think it was last week.
No, not. Okay, is that quick? Okay.
It was last week. Honestly, I didn't get any bruising under my under eyes at all.
Did you
Yeah.
did you like do arnica and all that stuff?
Yeah, so before I came to the appointment, I had arnica cream that I put on, and then after I put it on like 2 days before. I don't know if I was supposed to or not, but I just did it. And then after the appointment, Vanessa she put some more arnica cream on,
Okay.
and I also took the pineapple pills. What are those called?
Bromelain.
The
Good.
Bromelain. The Bromelain. Yeah, I took those a couple days before the appointment, and then I took it a couple days after the appointment, and I haven't taken it since. But
Okay.
yeah,
But like, were you swelling really bad or you were okay?
I don't know. No, not really. Well, the first day it was like a little swollen. My chin was also a little swollen, but I want to say it went down after I iced it after like 2 days. But even when it was swollen, it wasn't super dramatic.
Okay.
Like I was out hanging with my friends like probably the next day, and they didn't even say anything. So I don't think they even noticed.
Okay.
Yeah.
Let me see from the side. Oh, I love it. I love it. I love it. I love it. So we did some filler into the chin. We've done this previously. I don't know when the last time we did that one was.
So we did my jaw. I want to like a year ago, a year and a half ago or so. And then we also did the chin, and I just wanted to add just a little more, just to have it protrude just a tad bit. I don't know if you can see it or not.
I can see it. I know your face.
Okay, I don't know if you can see it or not, but I don't know. I like that it just makes my face more like balanced. Because before I just felt like my chin kind of sat back a little bit far. And I don't know, I feel like I still look like myself. I don't look in the mirror and like, oh my God, what did I just do? You know, like some people that's like really like puffy faced.
Oh, I'm like, we were looking at your picture. I don't know. I feel like you still look like you.
I
Is
know I
it
do.
fresh?
I feel like I look like me, and so first of all, my birthday is Sunday, right?
Okay.
So I've been spending this whole week, and I'm just like going out telling everybody like today's my birthday so I can get my free desserts. And they're like, "Oh, how old are you?" And I'm like, "Oh, I'm about to turn 33." And like everyone is like flabbergasted. They're like, "Oh, I thought you were in your 20s, like 25, 26." I'm like, "Thank you so much." But I feel like it, but I'm not, you know.
Yay! I love it. And thank you thank you for sharing. I tell you guys, I appreciate you and like my patients because I'm like, nobody would know. Nobody would look at you and think you've done all the stuff that we have done.
I got Botox
He's
as
got
well.
Botox. He like stays consistent with skincare, with all the things.
I'm
Like,
reach
I felt
out to
like,
you.
yeah, I was like, I haven't seen Milton in a little bit. Where has he been? And then you came and I was like, he's just in another country.
I'm
Speaking.
here. I'm here.
I'm so
Yeah,
happy
I'll
for
be
you.
leaving. But no, I just wanted to let you know that everything's healing very well. Just everything's feeling really good, and you know, I love it. I love my results.
Yay. I hope you have so much fun on your trip.
Thank you, thank you.
Have a great time and happy birthday. So thank you for sharing, Milton. We appreciate you so much and we love seeing you. Oh, we did your hair.
The best injector. Oh my God, we didn't even talk about that.
I know.
No, like that's besides everything else. Like, yes, you make me look and feel great, but my hair, bruh.
Your hair is so long.
My hair, just to give y'all a backstory, I was losing my hair. So my dad, his hairline kind of starts receding. And Dad, if you see me live and you hear me talking about you, like, look, just forget it. Yeah, so his hairline was starting to recede, and also like right in the crown, he was losing hair, and I was literally doing the same thing. Like my hairline was starting to recede, and I actually found out because I was working out and somebody took a picture of me, and I saw the middle of my head, and I was like, oh my God, I'm losing hair. And I think I started stressing myself out about it because then it started coming out. It was like it was like falling out more rapidly. In addition to that, like, I was bleaching my hair as well, so that wasn't helping. But we did I forgot how many rounds of PRF. It's the PRF injections, right?
The injections. I feel like you did it for like 6 months.
Yeah, so we did it for about 6 months. And there was like a noticeable amount of growth. And then we started with the Nutrafol, and then you just recently put me on, I want to say about 3 or 4 months ago, you put me on or you prescribed me it's like the minoxidil and the finasteride.
Yep.
Yeah.
That one. And you did the scalp facials.
Oh yeah, and I did the scalp facials. I don't know if you guys can see, but like my hair is like, if you saw the before pictures, like my hair, it was like a big bald spot right here.
I'm gonna post it before so people can see.
Yeah,
So
there was like a
good.
little bald spot right here. My hairline was starting to come back here. I was getting a LeBron James. I was like, yeah, no, we gotta take care of this.
You told me you're like your barber could tell, and that's when I was like, okay, great, because he's gonna be looking at your head and knowing all stuff.
Yeah, no, my barber, he tells me all the time, every time he's like, oh, it's looking thick, it's looking thick. And like today, I actually just got my hair cut today because I'm going out of town. But he was like, this is like the longest that I've ever seen your hair right now. Like my hair is like, it's super coily. But like he picked it out and it was like, it was really long. And I was like, yeah. So we trimmed it down a little bit though, because I had to clean up the edges. But I just want to say you saved my life because that was like my biggest insecurity. And like, I haven't had this much hair since I don't know, like my early 20s.
Oh,
Yeah.
thank you, Milton. We love seeing you, and thank you for coming on here and sharing and just being awesome. So we love you.
Thank you. Bye.
Okay, I'll see you later. Bye.
Get ready for my flight.
Oh yeah, have fun. Can't wait to check up.
Bye.
Let me see. Okay, and then let me. Oh, I'm trying to turn on Samantha too, and then I'm gonna get ready to go. Hey, Sam. Samantha, you're there?
Does that work? Okay, I'm here.
Oh, beautiful. Sorry, I came on earlier. We were gonna come on at 4:45, but then I have to go get my kids in a minute early today.
You're good. Sorry, I was running a little bit late today, you know?
You look good. This is Samantha. She is one of our nurse practitioners in Vegas. I'll be in Vegas with her on this upcoming Friday. So you guys can come see Samantha, and she's excellent, and do your virtual consults with her.
Yeah.
Let me see. And Sam, I'll see you Friday. And then, right now we're having a special on Botox with you.
Yeah, so let me tell you about the special that we're doing in Vegas. If you come see me for a 100-unit vial of Botox, which I think is a great amount if you want to do like upper face, mid face, if you're wanting to do more units like through the masseter or even through the neck, then we can hit a lot of different areas of your face and your neck. And if you do the 100-unit vial, then I can give you $50 off in Vegas.
So come see her. I'll be there with her this upcoming Friday and next Friday. But you can go see Sam. She's there like all week long. And she's doing all the skin treatments there with our esthetician and doing your natural filler, doing your Botox. Like, this is your girl. And I love seeing, and you will see her on virtual consults. So I see a lot of the patients that you treat, like we see each other's patients that we consult virtually. Can you tell real quick what goes on a virtual consult?
Yeah, so the virtual consults are great. It's a great way for you to get an introduction to us. So we get to know you personally. And then we do a really detailed assessment. So I always start by getting to know your past medical history. And we want to make sure that you're a good candidate for all the treatments that we are going to offer you. And then I ask about the aesthetic treatments that you've done in the past. So I want to know, have you done Botox before? Have you done filler? Have you done any of the skin treatments like facials, and I want to know if you've had any complications. So if you've done laser treatments and had severe burns or anything like that that is abnormal, I want to know just so we can make sure that if we treat you in the future, we're going to keep you safe. And then we get into your concerns, the things that you're hoping to achieve with your treatments that you're going to get. And then I create or start creating that customized plan for you. And then we always kind of go back and forth. So I'm going to talk with Janelle about the things that we've discussed, and same with me, so that you know when you get scheduled with a provider, they're aware of the consultation that we've had. They know the idea for the creation of the treatment plan. And then when you come into clinic, we can kind of just get right into giving you treatments, and you feel really confident about what you're going to receive and the results that you can expect.
Yes, I like doing the consults because, like she said, you build out that treatment plan, and then we will also send home, not send home, we message you information about all the treatments. We have videos, we have written information about it that you can review. We send you pricing, financing. So you're able to review all of that. And then the pre-care, the post-care. So you are prepped before you come in to the office for your appointment. So I love doing them. And I feel like our patients come in informed, not making rushed decisions. You know, they already are feeling more comfortable because we have discussed all the things thoroughly before they even come in.
Yeah. I think you get better results. Like if you are following the pre-care and post-care, then you're just going to get better results. You're going to be more confident. And then we also talk about things that you have upcoming. So if I know you're preparing for your wedding or for like a big event coming up, we plan and tailor your treatments around that. So you're not coming in, getting your Botox, and then expecting to have the results in 2 days when I know you need 2 weeks. So that's why we really need to have time to talk and go through all of those things.
Yes. Okay. Any other things, Sam? I'm just gonna go get these babies, but we're supposed to be going live. This was my fault, guys. I told her let's go live on Wednesdays at 4:45, and then I came earlier today. So I'm sorry, Sam. But we can probably on Friday, hopefully either before or after patients, we can try to go live, or if there's somebody that like will share, we can go live and talk through anything. But you guys should also follow our clinic page that Sam is running off right now, Jossie Skin. She goes live there as well. And so talking through all the treatments that we do, talking through just the same thing. We're here to educate, help you make decisions that are well thought out when it comes to doing any of these beauty treatments.
Okay. I will see you on Friday, and then hopefully people will pop on and we can chat then.
Okay. Thank you, Sam. Thank you, Milton. I hope you guys have a great night. Talk to you later. Bye.